On the government's message to the people in this period, I'm now being joined by the Minister of Information and Culture, Mr. Mommhamed. Honorable Minister, thank you for holding on. Welcome to TBC News.
Thank you, Bukola.
Yes, so we've been getting daily reports from the Presidential Task Force on Covid-19. But some of the reports also say that we're recording new infections in some states that didn't hitherto have cases of coronavirus. Is Nigeria winning the war against the COVID-19 pandemic?
Well, clearly, Nigeria has taken the right steps. We kept saying and reminding the world, there is no known vaccine or cure for this disease at this moment. So all we can have is what is called non-pharmaceutical intervention, which is social distancing, keeping personal hygiene, not congregating, together, washing your hands, among other things. And I think the whole idea of the lockdown, especially in Lagos, Ogun, and the Federal Capital Territory, is actually to slow down the spread of the disease on the one hand, and at the same time, give time for the medical response. To the extent that the government has ordered the lockdown in those two states and the Federal Capital Territory, the government has taken the right decisions. In addition, the government has taken this period to double its efforts by 1, increasing the number of laboratories, 2, increasing the number of isolation centers, ramping up training of personnel, and all these measures are aimed at slowing down the rate of the spread. Regrettably, we have not been so successful in the level of compliance of the populace. Some still don't believe that COVID-19 is real. Some believe it's nothing but the disease of the elite. And some have just outrightly refused to obey the lockdown order, while some don't believe that congregating in one place can only lead to the spread. So we want to seize the opportunity to appeal to our leaders, to our people, to please accept that COVID-19 is real. Nobody is immune to COVID-19. And so far, the only approaches you can adopt are what we're adopting now. That is lockdown in certain states, sensitization campaign, advocacy, and Nigerians must be ready to cooperate with us. Otherwise, we will lose the benefit of the lockdown.
All right, I'm going to pick up on one of your points about increasing testing centers, which is key to checking the spread of COVID-19. But there are reports in relation to that private hospitals are also beginning to deal with this novel virus. What efforts is government making to equip them to deal with them, particularly where testing is concerned and the treatment especially of these patients?
I think the task force and the Center for Disease Control in particular have made it clear that only accredited facilities, whether private or public, can handle either the testing or even the treatment. Therefore, all hospitals that want to either test or want to treat COVID-19 patients must be accredited by the Center for Disease Control. In Abuja, we had the Commissioner of Lagos State that led the accreditation team to accredit the various isolation centers which have been provided in Abuja. So our advice is the same. Please, no private hospital without being accredited by the NCDC or can handle or treat COVID-19 patients. Our laboratories, which I think they call them molecular laboratories, also must be accredited by the NCDC. And I'm not aware that there's any laboratory today that is working that is not accredited by the NCDC. If there's any, I'm afraid I would not advise anybody to take the results of that laboratory seriously.
I'd like to follow up on that, but there is a lot to cover. There's a seeming backlash from the invitation and arrival of the Chinese doctors into Nigeria to assist with the care for the treatment of COVID-19 patients. Now, this there's a consequence where that is concerned following reports of attacks on Nigerians in China. What diplomatic efforts is government adopting to address this?
No, I think the federal government is already handling this matter. But I'm talking about the alleged treatment of Nigerians in China. However, as to the issue of Chinese doctors in Nigeria, I think a lot of this is to us at the PTF nothing but distraction. The truth of the matter is that the Chinese construction companies working in Nigeria have offered about 256 items, to Nigeria to help us, contain the pandemic. They've also come with a team of experts, doctors, technicians that would install these equipment. They've also come to exchange ideas with our health authorities on how they were able to contain the pandemic in China, and in addition build the capacity of our people, of our health authorities. I mean, we've said it several times, the Chinese doctors are not here to treat any COVID-19 patient in Nigeria.
So what are they here to do specifically if they're not assisting in treatment and care?
Bukola, you see, they have come with 256 items of equipment ranging from ventilators to other things, and they are here primarily to put our technicians through on how to set up and run this.
The WHO has warned of possible food insecurity as a result of the lockdown. Where does that leave Nigeria that relies heavily on food imports?
Now, can you please come again, Bukola?
There are reports that as a result of the COVID-19 pandemic, that there may be food insecurity around the world, particularly in developing nations. So for Nigeria that relies heavily on food imports, where does that leave us?
Well, I don't agree with you that Nigeria relies, largely on food imports. Under this administration, I think food security and food security has been achieved to a very large extent. However, one thing that is clear about the pandemic is that it doesn't just attack your health, it attacks also your wealth. It attacks your source of production, and it attacks, your economy. So to that extent, I agree with you, Busola, that the task ahead is even more daunting post-COVID-19. And this is why the federal government has set up two other committees to look at the actions and the measures to take post-COVID-19 to ensure that our economy does not derail. As to the issue of food insecurity, it is real. I agree with you, because if your productive team force is attacked by a disease or they cannot go out, of course, yes, it's going to have an impact. And that is why we implore all Nigerians to please listen to the advice of the medical experts. Listen to the advice of the Center for Disease Control. Listen to the advice of the task force, so that we can spend less time under lockdown and resume our normal life, be it social, political, or economic.
Honorable Minister for Information, Mr. Lai Mohammed, thank you for your time and updates on efforts of Nigeria to check the spread of COVID-19 on TVC News. Thank you very much.